The FDA has approved COVID booster shots that target the BA.5 Omicron variant. This is the first time a new formula has been approved since COVID vaccines were approved at the end of 2020. The CDC is expected to give their approval today, clearing the way for shots to get in arms following the holiday weekend.
The FDA's approval is being met with some criticism because of the lack of full clinical trials. Instead, the agency based its decision on the current vaccines and testing on mice. It's the same strategy we currently use for the flu shot. Here's CDC Director Rochelle Lewinsky on the matter.
There's always a question here of being too slow versus too fast. And I think one of the challenges is if we wait for those data to emerge in human data, not just mice data, in human data, we will be using what I would consider to be a potentially outdated vaccine.
Look, I have been perfectly clear on how I feel about this. I want people should be allowed, even without the CDC's approval or the FDA's approval, to take medical products that if they consent to take it, this is again a philosophical issue. I don't think the government should come between. If you want to do this, doctor wants to give it to you, there's consent. Consent has been reached. You're an adult, fully capable of making your own decisions. And the government says, well, it knows better, it's not going to let you. And they've dragged their feet on so many things before. That said, now all that aside, I think it is important to eventually get this data. And if people have hesitancy about taking this because there has only been research on mice, I think that is perfectly understandable. It would be crazy to mandate or require anything like this, from my view, without having. I mean, I wouldn't require it mandated in any, even if we had the data. But to do so without data, clearly some people need the clinical data to reassure them that this is safe.
Sure, yeah. So first and foremost, I do think that the context of the level of testing being similar to what we do with the flu vaccine, will be reassuring to a lot of people. I think that makes sense. Of course, that doesn't preclude there being some potential issue, which we will find out about, to your point, once people start getting boosted and we track what the effects have been. Now, it is frustrating because I think a lot of people have rightly pointed to the lack of transparency and the lack of conversation in a mainstream way around some of the evidence that's come out around the original COVID vaccines. And people might have skepticism that we will eventually ever have an honest conversation now about any vaccine or any medication that comes down the pike because of how the CDC has been conducting itself. But I just see an article recently asking, can the CDC reform itself? There is obviously an internal conversation happening at the organization about trying to remedy some of the mistakes that have been made over the last 2 years.
It was very satisfying to hear Walensky concede that there needs to be major reform, and there needs to be, and there's not enough acknowledgement of individual difference. It could be the case that the risk to you of a medical product that has not had human clinical testing. Well, if you're in a very at-risk category for COVID, if you're very ill, if you're very elderly, maybe the small risk that there's something bad about this vaccine is absolutely worth taking because your risk for COVID, even a second or third infection, is so much more significant. And that could be true for you and not true for a younger person who is very healthy and whatever even small downside potentially of a vaccine that's not had that clinical data, that could still be higher for you than the risk of COVID if you've already had it. Who knows? Yeah. It's different for different people. And that's what's so frustrating, that so much of the pandemic response was not at the level of individual choice, but was at the level of, well, no, here's what we think everybody needs to do.
Yeah. Well, I also think it'll be exciting for folks to get a booster that's actually targeted to the variant that's in the air right now. Right. It's been a long time. It's anecdotal, but it did feel like a lot of people who did get vaccinated and boosted were largely able to avoid COVID that first summer, at least, as we opened things back up, because it was you're a little bit
not
more
typhoid Robby.
Don't tell the world my nickname for you, Robby.
She literally does call me that.
And out of affection, of course. But yeah, I do think that the prospect of getting to a level of protection that we had in the summer of 2020 will inspire a lot of people who have fallen off of the kind of booster cycle regime, myself included, to want to maybe plug back in. And I look forward to hearing more numbers about that. The Department of Health and Human Services has acquired 170 million updated COVID boosters for a fall and winter vaccination campaign. Here's White House Press Secretary Karine Jean-Pierre.
We've been working for months to be prepared for this moment and to get shots into arms this fall and through the end of the year. So we are prepared to do that. So with FDA's authorization, doses can be shipped now to tens of thousands of sites nationwide, and shots in arms can start as soon as possible after CDC issues its recommendation later this week. All states have ordered doses already.
Meanwhile, HHS is expected to run out of funding to buy and distribute COVID vaccines as early as January. Will also run out of its federal supply of several treatments in the first half of 2023. The federal government will also end its offer to ship free at-home COVID tests. Yeah. I am not, well, you might disagree on this. I will not mourn the end of the free COVID test government thing. It's like we never do enough with that. Like, people test. I don't think the tests are. You can be sick and have COVID, and it takes a while for you to actually test positive for it. I mean, that's been true. Maybe that's not true, right? This goes in phases, right, with different variants for how reliable the tests are being targeted the variant. People can, I mean, the tests are available in stores, and it costs a little bit of money. Some of them cost a lot.
Some of them cost a lot, Robby. And we have to remember, not everyone thinks that, a $14 purchase is incidental to their budget. And the reality is, it's not just the cost of the thing, it's the convenience of getting it. Look, when I felt sick and had tested negative at the beginning of the weekend, and a few days went by, and it was a Monday night, and I was thinking, all right, I'm going to go in to Rising in the morning, let me test just one more time. I used one of those Biden tests that I had a big stack of. I didn't think, I have to save these tests because I want to save the money and don't have to replace my stockpile. I double tested, even though I had just tested like the day before, and it came out blaringly positive.
Yeah.
And I saved everybody from having to come here and me being the typhoid Mary of the Rising studio. So look,
I'm not against the testing. It just seems like it's not the whole ship it to people. Like, in some very ideal world, right, if you could just, every day before you go, or kids, if we have so much concern about kids in schools, I want them to be unmasked and generally unrestricted. What if everybody, takes a quick test if it was very easy to do it right before they came in the building, it's super reliable, and you send someone home immediately if they're test positive. Like that, there are ways for me to conceive of really robust testing doing public good. Actually, at the beginning of the pandemic, that's how I thought we would eventually get back to normal. Was a lot of people were talking about the testing, because I didn't expect the vaccines, based on how long it takes for vaccines to come out. I thought the vaccines could still be 2 to 5 years away. And then maybe only work as well as the flu vaccine and not really prevent cases. So I was thinking it was going to be, we're going to live in a world where there's just, you go to the restaurant, you take a test, there's going to be testing everywhere, and they were actually going to have some enforcement for it. So I thought that's what was going to happen. So that didn't happen at all.
Right.
The vaccines ended up coming out a lot faster than we thought. It initially looked like the vaccines were preventing transmission as well. Then that we've gone through several permutations.
So are you saying that you would prefer there be a different kind of testing regime than sending tests at home?
I think in my ideal world, I would have viewed testing as a massive on like a mass scale, a huge investment in testing as a good way to get back to normal without having super coercive methods on people.
So you want the government to do more?
Oh, yeah, this is what you're trying to get me at. If the government is going to do something, I thought massive investment in testing beyond just shipping it to people.
Okay, so I don't think these things are mutually exclusive. We talked about this a little bit when you came on my podcast last week, but I do think, if you do care about kids, let's say in this DC school situation where they're requiring vaccines, if you care about them being vaccinated, instead of a mandate, have a vaccination center set up in front of the school, do those kinds of things. That's not happening, but I think people should be concerned. Right now we're in a lull. If we are in the middle of a new variant and have death spiking in hospitals overburdened and things like the way we've had in the past going into the winter, we're going to be really concerned that the government isn't maintaining its stockpiles and that it's going to start charging for the kind of interventions that are actually going to be life-saving at that point.
Well, on this topic, when White House reporter Philip Wegman asked the press secretary on whether Biden will opt for another booster soon, Karine Jean-Pierre pointed to the president's natural immunity. How about that? She said, obviously, the president was just infected with Omicron and is really well protected, as you all know, against COVID, adding that while she doesn't have an update on timing, he absolutely will get an updated booster. Yeah, I think that this was originally why I didn't for myself, choose to get a booster
Because you got COVID so often.
I've only had it once.
Fair enough.
But I got vaccinated and in April or whatever of 2021, and then COVID in July. So then I was like, well, I'm not going to get boosted, right? I'm going to wait like 6 months or something at least before I get a booster, and then I just never ended up doing it. But
Yeah,
do have some. We know that you have some additional protection for some length of time after you get COVID.
I mean, the only issue is that it's not quite as long as people had hoped it would be. I think it's only about a month or so.
Well, now that's what they've said for the newer variant. That it seemed to be more robust than that for the original and for Delta, maybe not for Omicron or what we're dealing with now. But,
right. Right. So after I got COVID, I had my risk-taking behaviors and had the inside dining experience.
Oh yeah, were you having
that elapsed? My 1 month period of daredevil activity has lapsed, and I'm going back to look. It hurts no one. You're a libertarian. My body, my choice. You want me to live my own freedoms, and these are my choices. But yeah, I do think that we definitely need to keep an eye out on, a particular eye out now on what happens with infection rates, et cetera. Now that the government is basically saying that you are completely on your own.
Infection rates, but that should not be our benchmark. Hospitalizations, deaths.
Well, that too, but also, I'm sorry,
because we've had spikes in infections that do not necessarily correspond with increased hospitalizations.
Right, but Robby, we just had a guest earlier this week, and people should definitely check that out, who was a doctor who talked about research that is really concrete about the reality of long COVID and how that's going to be a huge burden to our healthcare system and costs that we're all going to have to share ultimately. So there's a lot of factors going on here.
But in Washington, D.C., which is where I live, so I've paid closest attention to the data, the spike in cases produced by Delta and Omicron did not increase deaths statistically, which is a good thing. So we got to move, and that I remember having those conversations about how we need to move away from cases. All right, we'll have more Rising in just a minute. Stay tuned.